In honor of Stroke Awareness Month, Dr. Michael Haboubi is here to help us understand stroke symptoms and what to do if you see them. So let's start with those symptoms. What are some of the things you might notice in yourself or maybe someone else?
Yeah, well, thanks for having me back, and this is Stroke Awareness Month, and so the acronym we use, and we're trying to really get everyone to understand, is B FAST, which is any sudden changes in B balance, E eyes, where you have double vision or loss of vision in one eye, F face drooping, A arm weakness, you have them hold their arms up and if the arm starts to drift down, S any speech trouble, they're speaking garbled or having trouble getting words out, and then T, time to call 911, because in a stroke you can lose up to 1.9 million brain cells every minute, so time is brain. The faster you get to the hospital, the better. The more we have options we have to reverse a stroke or minimize the damage caused by the stroke.
So that was my next question is what do you do? And it sounds like call 911, most important thing.
Absolutely, because time is brain. There's a lot of people that we see where they have symptoms that would lead to severe disability, and we get to see them walk out of the hospital either with no symptoms or minimal symptoms because there are things we can do to help.
So important to get that help, okay. And then what about when we think about groups that might be more susceptible, more at risk? Who are those people?
So the biggest risk factor for having a stroke is age. The older you are, the more likely you are to have a stroke. But we see strokes in teenagers. We see strokes in, not at university, but at the Children's Hospital, we do see even kids having strokes as well. So it can happen in people of any age, and it's always important to be on the lookout. If you have something that just doesn't seem quite right, better to be safe than sorry. And then the other thing I always try to advocate for is that when it comes to public equities of health, we want to help people who are more at risk, high blood pressure, high cholesterol, diabetes. If you smoke, these are all things that are going to increase your risk for strokes. If you have an irregular heart rhythm, atrial fibrillation, that can also increase the risk of stroke as well. So knowing what your risk factors are can certainly help you prevent a stroke if you can get them under control.
And with just a few seconds left, I know you have a very important event, so tell us about it very quickly.
Absolutely. So my boss, Dr. Carrie Remmel, is going to be giving a free talk. It's going to be on Zoom. We're going to have the link available, but it will talk about all the things that you can do to prevent a stroke and also to help identify a stroke that I can't do in 3 minutes. She can do in a lot longer.
Well, thank you so much, Doctor, and we will have you linked up to that on our website, WHAS11.com. Like you said, it's free and it could save a life. Thank you so much for coming on.
Thank you so much.